Hi everybody, it's Dr. Barby here, and I hope you're having a wonderful day. I wanted to come on here with something that has been weighing on my mind, and I have been discussing this with a lot of my patients, my intuitive eating clients, and friends who have recovered from an eating disorder, and that is body dysmorphia, or the amount of disconnect between the reality of how your body looks like and what you think or feel, really think, but a lot of people feel it, that your body looks like. And this can be quite associated with eating disorders, but not always the case. It can be on its own. The main difference is that if it's on its own, the person doesn't necessarily feel the need to control the body weight. But when it comes together with the eating disorder, we see that the false assessment of how they look like also leads them to more eating disorder symptoms. Now, in the general population, body dysmorphia, we see it in about 2.3 to 7% of the general population. But we see it in at least 25% reported of the eating disorder population. I was trying to find a statistic to see how much it remains after recovery from eating disorder in a recovered eating disorder person, but I couldn't really find the statistic. What I can tell you is that a lot of my intuitive eating clients and my friends and patients who are recovered or recovering from an eating disorder continue to have body dysmorphia despite complete recovery. And I am actually one of them as well. I have body dysmorphia, and even buying for clothes can be very stressful because I never get my size right. And then if I go in person, it is very stressful because actually trying on things becomes more dysphoric or dysmorphic to my body image and the objectivity of the body size. And so I really try to just stick to the clothes that I have unless I absolutely need something new, and then I understand and prepare my brain that this is not what my body actually looks like. This is what I think my body looks like, but they're not necessarily related. Now, what's interesting is that the statistic is not absolute. Like I said, I have not really found anywhere that has a statistic of how much body dysmorphia a person continues to experience after recovery from an eating disorder. And I will say that though my body dysmorphia was quite severe during my eating disorder, I find that the thoughts and the body image is more pronounced now than it was during my eating disorder. And mostly the reason could be because during my eating disorder, I had a coping mechanism, a compulsion, and a full sense of control to help with the dysmorphia thoughts. But now I don't really have any such coping mechanisms, which are not really healthy coping mechanisms that help in the long term or in the short term, really. But the main way that I typically deal with is two things. Number one is I am aware that what my brain tells me is a lie. I cannot trust my brain. And despite not believing what anyone else tells me, I know that what I think and see also is not true. And everyone has their own perspective. So in general, truths are somewhere in the middle of two people's thoughts. But with the body dysmorphia, I know for sure and for certain that my thoughts are complete lies. So I don't pay attention to them. Even though they are present, I try to distract myself, use a dialectical behavioral therapy, and also I use opposite of emotion action, regardless of what I think about my body. And number two, for other people, so there's no comparison between me and other people in my brain, is I call it the floating heads method. I see everyone from the neck up. So I almost imagine like people and myself have an invisibility cloak wrapped around us from the neck down. I really see no one. And when I talk to someone, I really focus on their eyes and really try to focus on the conversation. So it helps me stay mindful of the conversation while also not dwelling into body comparisons with the other person. I hope that helps.